Hi everyone, Dr. Joe here. Today we will dive into a topic that affects a lot of people, herniated disc. But first, let's talk about something called spinal misalignment and how it can lead to a condition called subluxation. So to start, let's break down the structure of the spine. We have front and back segments that up and down and of course the disc and nerves. Whether it is big event like a car accident or accumulated smaller injuries, one of the spinal segments can get out of the place. Often this means it shifts toward the back and tips down, especially in the lumbar and cervical region. When that happens, it can irritate the nerves nearby. Now, I want to clarify that this overview is quite broad, so it doesn't cover every variable out there. But it is important to understand spinal subluxation is a precondition to disc problem, ranging from degeneration to more severe issues like disc sequestration. Especially disc-related problems often stem from disc misalignment, and that's a key point to remember. The discs themselves are fairly parallel, although those in the lower back and neck have some differences. The central part of the disc has little gelatinous ball called the nucleus pulposus, which sit between the bones above and below. Think of it as a pivotal ball that should remain centered. The spinal cord runs through a large canal. The spinal nerves exit through small holes between the segments. When things go wrong, the spinal segment can shift backward and downward, leading to disc degeneration. Typically, this misalignment creates uneven pressure on nucleus pulposus, causing it to move forward. When that happens, the surrounding structure called annulus fibrous stretches. It usually can't move forward because the anterior longitudinal ligament blocks it like a barricade. However, as the pressure builds up inside of the disc over time, often due to imbalanced force to the disc and inflammation, this imbalance can lead to tears in the annulus fibrous, which is the weak point where the least resistance occurs. Common tear sites are at the back and side, where the spinal nerve roots are located. Now here's something interesting. Some people can have significant disc issues but feel no symptoms at all, while others might experience severe pain or difficulty walking. It is essential to understand that no pain doesn't necessarily mean everything is okay. I have seen this more in China than when I was in the United States, likely due to competitive educational environment where people sit long period and use smart devices constantly. I have been observed end-stage degeneration in teenagers and reverse cervical curve in their under 10 years old. And yet many of them report only mild soreness or stiffness or even no pain at all. In most cases, these issues can be treated conservatively before surgery is needed. The treatment typically involves correcting subluxation back to its original position based on the X-ray analysis. Once it is done, the disc can begin to heal. Now here's an important point. The spinal disc is avascular tissue, meaning they don't have blood supply. It starts between the age of 20 to 30. The only way to get nutrient and oxygen is through movement, a process known as imbibition. If you don't restore spinal subluxation, the disc tissue cannot receive nutrient it needs and start to deteriorate. Once you receive a proper spinal adjustment, your disc can start moving again, allowing waste material to exit and fresh oxygen and nutrient to enter promote healing. Of course, strengthening the surrounding muscle is crucial too. It is always better to prevent these segmental problems from the first place. Now let's touch on posture. If your pelvis is shifted forward while your mid-back shifted back, that creates too much extension in the low back, increasing pressure. If your back is not strong enough to handle that force, it can lead to subluxation again. So maintaining good posture is vital for healing. When it comes to the movement, especially during lifting, overextending or flexing without proper hip hinge can lead to the issues we have discussed. Some people might even feel a loud pop and experience immediate symptoms. They often have subluxation due to poor biomechanics. All these points are essential from preventive standpoint. Now let's say you had surgery before part of your disc was removed. It is common to experience different problems or even same one afterward. Even post-surgery, if you still have segmental issues like subluxation, poor posture, and movement problems, those underlying causes haven't been addressed. Simply removing part of the disc tissue to relieve nerve pressure doesn't correct root problem. If segmental pressure remains due to subluxation and the balance is off, these issues will likely return at the same segment or segment above or below. That's why whether you are pre or post surgery, checking for core problem is essential. I really hope you address these issues before they escalate into a crisis. So remember these 3 key points: segmental integrity, posture, and movement. If you keep these 3 aspects healthy, you will be better equipped to maintain your overall health and quickly fix any problem that arises. Thanks for watching and take care of your spine.